Another famous First Amendment free speech case had to do with defending, actually the Supreme Court, again, upheld the right of neo-Nazis to march through Skokie, Illinois, which was a town that had a disproportionately high number of Jewish individuals. So neo-Nazis marching through Jewish neighborhoods. All of us find that distasteful and disgusting. Right. But the court rightly recognized, as with dealing with the Communist Manifesto, the court was not endorsing either Marxist ideology or neo-Nazi ideology. What the court was saying is the best way to deal with these ideologies is to get them out there and subject them to critique, let people show their true colors, and let the best ideas come forward to deal with that and answer that. And the minute you try to suppress them, the minute you anoint a government official or anyone else as the arbiter of what's true and false, you're opening yourself up to all kinds of abuses, because those in power, if you give them the right to censorship, spend most of their time, in fact, not censoring false ideas. They spend most of their time focused on censoring true ideas that happen to be threatening to their interests. And that's exactly what happened during COVID. That's exactly what we presented to the court in the Murthy case. And for purposes of our legal arguments, we don't have to establish that what I said or Jay said or Martin or Jill was true. But the fact is, much of what we said was true, and the government was the one that was mistaken. And the government later came around to acknowledge our position. So the CDC now endorses my position that we shouldn't discriminate between the vaccinated and the unvaccinated, because vaccines don't stop infection and transmission, and natural immunity is robust. That's precisely what I got censored for saying. And my only crime was being 9-10 months ahead of the curve of the public health establishment. So it is, I think, it's not legally necessary to establish that what we said was true, but it's worth pointing out that we were censored precisely for being correct. And the government doubling down on a mistaken policy, refusing to pivot or change course, and slapping down or silencing any critic of their policy, that is a recipe for stagnation, for bad policy going on much longer than it should be. That's removing one of the key kind of safety or corrective mechanisms to help us change course if we start doing something that's not working, or that is starting to prove to be harmful. We need to be able to pivot and go in another direction. Censorship doesn't allow that. Censorship tries to fixate the quote unquote current scientific consensus as unassailable. Then you've just spelled the end of science, right? Science and censorship, medical progress and censorship, they're totally incompatible. Science relies on hypothesis, on conjecture, testing, refutation, argumentation, refinement. None of this can happen in an environment of censorship. Any advance scientifically occurs because it challenged what everyone thought they knew, right? And introduced a novel concept that initially people thought were crazy. Famous case in the history of medicine of the obstetrician who in the late 1800s started hand washing. And he did the study in the hospital to show that if I wash my hands, then rates of infection and pregnancy complications for these women and newborns are lower. And he was drummed out of the medical profession for being crazy and superstitious. And what could washing your hands have to do with, obstetric outcomes? They didn't understand the germ theory of disease at that time. And so they just dismissed him as a quack. And of course, he turned out to be absolutely correct. And it was a major discovery that improved patient outcomes, at very low cost, precisely the kind of thing that medicine needs to advance.